इन्फेक्शन होता है। तो मैं तो यही कहूँगा कि रिसर्च करना चाहिए और पूरा इन्वेस्टिगेशन करना चाहिए। अभी कोई इमरजेंसी नहीं है, तो इन्वेस्टिगेशन करके वैक्सीन सेफ होगा तभी इसको हाई रिस्क पॉपुलेशन को देना चाहिए। मास वैक्सीनेशन का कोई भी अभी ऐसे हमारे इंडिया में कुछ डेथ्स हुए जो कंफर्म हो गए। डॉक्टर स्नेहल लोनावत केस है, सबको मालूम होगा कि उसमें एस्टैब्लिश हो गया है कि ये वैक्सीन से है। तो हो सकता है ऐसे कई बच्चों को वैक्सीन से डेथ हो रहे हैं और कोई बच्चे को आज तक कोविड से डेथ नहीं हुआ। 2 साल से हमारे पास कोविड का महामारी था, वैक्सीन आने के पहले हाई पीक था, कोई बच्चे का इतना हाई इंसिडेंट्स ऑफ डेथ नहीं हुआ, जो कि वैक्सीन रोल आउट के बाद है। तो ये बहुत बड़ा एक रेड सिग्नल है, इसका पूरा जांच करना चाहिए। थैंक यू।
Okay, thank you, sir. Now we move on to Dr. Veena Raghav. She has done her MBBS and she has a diploma in anesthesia. She has worked in ICU during second wave of COVID in India, and she is working on lifestyle non-communicable diseases with clinical nutrition and yoga. Also, she uses anthroposcopic medicines for cancer. So let us listen to her. Dr. Veena Raghav, please.
Good morning, everybody. Namaskar. I would like to share my views of what I have been going through for the past 2 years, post this COVID vaccination drive that has been implemented all over India. So, you know what, this is like, when the Greeks couldn't fight the Trojans, they actually sent a gift called the Trojan horse. And that went into their compound, and these guys thought it was a gift, But actually, the soldiers that came out from inside started killing all the Troy, the whole country of Troy, So this is the same thing that has happened now in the case of the vaccine. It's like allowing something inside that will undermine our own immunity. That is what we are actually doing. And the mRNA that gets in, it doesn't even belong to our body. So you have to realize that there is a little bit of a problem over here. So when you talk about the Indian vaccination program, we had 2 vaccines, Covishield and Covaxin. Covishield was taken around 90% and Covaxin around 10 to 15% maybe. And if you could go on to, the companies, the Serum Institute of India and the biotech, you actually go down and get the data sheet from both those companies, you will realize that Covaxin is whole virion. It has 6 microgram of SARS-CoV antigen and it has about 250 microgram of aluminum hydroxide. So there we have seen a lot of neurological cases, like autism and Alzheimer's and multiple sclerosis. Whereas the Covishield is totally a GMO. It's a genetically modified organism. This is according to the data sheet of Serum Institute of Adar Poonawalla in Pune. It's a recombinant replication deficient chimpanzee adenovector encoding virus. And this is the message holder. You must have heard about the journal called Nature, which is very, very famous. They have said that DNA is delivered within
the recording has stopped.
Within the recombinant adenovirus vector. So what happens is, first of all, you introduce a foreign body into the human being, and that foreign body goes on producing more foreign bodies. So you have mRNA and the adenovirus vector encoding production of more recombinant virus. So what has happened, this AstraZeneca that was going on in the whole of Sweden, Germany, France, 15 other countries, they have not approved or they have withdrawn the AstraZeneca vaccine that went on in India. And Covishield and AstraZeneca are the same. And it didn't even take off in the US. It was totally rejected. In spite of that, we ran the vaccination program. And this is known to suppress the tumor suppressing genes, TL4 and TP53. You guys can actually go and verify this. It suppresses the tumor suppressing genes, TL4 and TP53. And according to Nature magazine and the Lancet and the BM it just says that the human body has natural antioxidants like glutathione superoxide dismutase, and the vaccine actually knocks off these natural antioxidants that are present in the human body. So today when you see the incidence of cancers that is going on, we hardly ever pick up benign cases. There were a lot of benign patients who were living with lipomas, with a small nevus here and there, and with neurofibromas, which were, dormant all the while. Suddenly, the lipoma becomes a liposarcoma, the nevus becomes a malignant melanoma, and, they start growing suddenly. And the incidence of malignant patients has gone through the roof. I'm actually seeing 2 new patients every week in my clinic. And the starting fresh cases also, they don't come up with a localized, cancer. They come up metastatic. That means already there has been spread into the lungs.
This meeting is being recorded.
And other places. So, and when you see cases that have already been treated and, they have actually keep doing their PET CT once in 6 months and they're totally out of cancer, all are now experiencing recurrences. So now you can actually make out that the incidence of cancer is really going through the roof. This, like Dr. Amitabh Banerjee said, we cannot pinpoint the blame on one factor. We have to investigate this, and this was never there before. And I would want to ask Daryl to just share a screenshot of one page that I had sent to him so that I can give you a little more details, and with that I'll close my speech. Yeah, this is an industrial engineer from Moderna, and another of them is a process development engineer from the same place. They have written out a whistleblowing message. They said the same thing must be happening in Pfizer also. They say it's hard to put together small things because what happens is when on the belt, on the conveyor belt, when the production of these vaccines are going on, there is intervention and there is manual addition of certain substances. Manual additions is a total unorthodox process when you have mass manufacture of vaccines in a setup. You just cannot actually go and interfere by hand. But this has been happening. And we got an explanation that highly sensitive trade secrets adjuvants are actually being added. So when you dig deeper, this is what we actually found. The guys who are working there in Moderna have put this up. It also codes for mutant versions of CYP19A1 and CDKN1B in smaller amounts. So when you make sure that when while delivery system gonads. And what happens is when the effects from the point number 2 and point number 4 join up, you get recessive mildly oncogenic effects in vaccine recipients unlikely to be noticed for many years. So we are actually seeing 2 patients a week immediately. Now, who knows, God only knows what is going to happen down the line post many years. And they also say the number 5 says it is recessive, but since most of the population is vaccinated, when the next female offsprings that we are going to have will have premature ovarian failure. And we can also have people who can be checked with AI, with robotics, and that is all because of the CYP19A1 and the CDKN1B that is being produced because of this mRNA. So this has to be actually investigated, and these people are whistleblowers, and they also say that because we haven't taken the vaccine ourselves, I'm sure we're going to get caught one day. So this whole thing is going on, and me working in the clinic and facing the cancer patients every day, I kind of realized that this has to be looked into, and that's why I thought I'll talk about this subject today. Thank you for listening in.
I think there is a huge problem because with audio. Please tell me how are we supposed to move ahead?
Yeah, Dr. Gayatri, please continue with the press conference. We'll fix it on the way. And then we are recording this session, so we'll broadcast it later.
Okay. Okay. So we now move on to Dr. Praveen Saxena. He has done his MBBS and TMRT from Osmania. He is a radiologist and clinical metal toxicologist. He is working in field of environmental medicine. He is into functional medicine and an integrative medicine expert as well. So, Dr. Praveen Saxena, please.
Innate immunity. This is something which has to be understood, because our ancestors historically relied on this innate immunity to defeat any kind of virus or bacteria and all that. And over the last 150 years, based on the good sanitation and nutrition, things have moved drastically better. Thing is, what I'm trying to put out is, this is something which we have to take some lessons out of it. I just want to tell about something called, in 2012, what has happened was there were 30 vaccines which were produced for so-called coronavirus, SARS virus and all that. And of that, this was tested for ferrets, and 4 were shortlisted, and this ferrets were given this vaccine. And initially, everything good happened, everything went off very well. What happened was, after some time, when these ferrets were re-exposed to any white virus or any other virus, they started getting into problems. This is not just with these ferrets. There was one more which happened in 1960s, which was called respiratory syncytial virus, and this antibody-dependent enhancement mechanism was well described when these things were given directly to the children. There were about 35 children who were given this RSV virus, and post that they got a robust immunity. Later on, 2 of them died, which propelled it was a huge FDA as well as all things people, and they banned this particular thing, which is called respiratory syncytial virus vaccine. And this is later on also there were events of hepatitis and all that. What I'm trying to put across is this particular thing, which was we as doctors were not aware, was that is vaccine. This is called enhanced disease, which was totally, it was like a bouncer for us. We thought vaccines are doing good stuff, but somewhere we have to, when we looked into, I had worked diligently on something like SIX. SIX was sudden infant death syndrome, which was the result of a pentavalent and hexavalent vaccines. And I can always tell you, this is called something like cot death or trip death. And there were some parents were investigated because of the death of the child, and they said there's something fishy, something has to be investigated. And somehow what we are seeing these days is something like SADS. SADS is sudden adult death syndromes. And somewhere there has to be, as Dr. Amitabh has said, yes, we need to work on that. I had somewhere I've been talking about this, that about innate immunity. I did enjoy when I got COVID with my OPD, but really it was a 2 or 3 day affair. We tried to work on some things and all that, and it went up good, and without any problems we were able to sort of work it out. The thing what we were trying to work it out is trying to work on this simple things like integrated protocol, trying to optimize vitamin A, vitamin D, trying to optimize sleep patterns, trying to work onto some things. And yes, after all these things, we were still not able to work on some areas, but the bigger challenge now comes to doctors like us is the increase, as Dr. Veena has told, number 2 cases of cancer per week. It is going to increase, madam, I'm sure. And you need to work out different strategies, what we are trying to work on that. And we have methodology where we can always see the blood coagulation. There is a thing called all the red blood cells, they start kind of coalescing each other. That's what we call our imaging. But I can always tell you, a pinch of salt, a kind of prevention. If there has to be a kind of thing when you have entirely all population is being vaccinated. You could have told there's a follow-up study you need to work every month. You can just go look at that lymphocyte count. You can look at that HSCRP count. Even if the lymphocyte is higher, we can always take them into separate bracket and try working on intensely in that. And that can save the nation. And this is what I have to say. Thank you for your attention. I think I have done. Any questions are there, I can always take up later.
Yes, thank you, sir. So till now we have done with Dr. Amita Banerjee from Pune, Dr. Veena Raghav from Bangalore, Dr. Praveen Saxena from Hyderabad. Now we move on to Dr. Sudha Chepiala. She has done her MBBS and MD. She is from USA, but currently from Hyderabad. Let us what she has to say. Yes, Dr. Sudha. Dr. Sudha, please unmute yourself.
Yeah.
Yes.
Hello, I'm Dr. Sudha. Thank you so much for giving me in this panel. It is my clinical observation. I see patients in US as well as I see patients in India. So for the past 2 years, it is my clinical observation that I have been sharing in this panel. That I have seen a lot of patients completely coming with severe autoimmune disease-like symptoms. Any kind of autoimmune disease-like symptoms is what I'm seeing universally. It's not only it's a globally we are seeing the same symptoms. I mean, what can connect us so in a short period of time? Globally, what is connecting us is what us as a physician, as an internal medicine, as a primary care physician, this is what made me think. It's acute amount of symptoms as well as chronic amount of symptoms has been exaggerating everywhere. Like fatigue and swelling and redness and low-grade fevers and numbness and skin rash and lymphadenopathy, like cervical lymphadenopathy, hepatic, hemangiomas. So wide range of, in one day of my clinical practice, when we see 20-30 patients in US, we are seeing wide range of autoimmune kind of symptoms. So it's made us think that there is something, a common factor which might be triggering the autoimmune disease, the autoimmune factor, the impairing the immune system. It is either attacking some kind of a B cells and the T cells that we need some research. We need all the physicians to come together. We need all the doctors to keep a thought process behind it. Why? It's time we ask this question, why? Why there is a tremendous rise in this autoimmune symptoms? Rheumatic arthritis, rheumatic factor being high, ANA being high, HSCRP being high, homocysteine being high. I can name these inflammatory markers which are going high. It's waking up the physician saying that please track your patients. Let us not take it granted that it is an autoimmune and it is some kind of, we don't know the root cause. Why there is a tremendous rise? Why we're not asking the question why? Suddenly why there is a rise? And we see a lot of patients here every day. We don't have time to track them, but it's time that we do something. It's time we track these cases. It's time we put all these things together and see what could be. It could be multifactorial. It could be multifactorial. Why this is autoimmune diseases are going so high is exactly what we are asking. So if we don't ask the questions now and if we don't look at these things in deeper manner, we will be missing the boat. If we talk about it, everybody's talking about long COVID. Long COVID is a characteristic. We are promoting long COVID. We are promoting autoimmune disease symptoms by inducing these through vaccinations. And we are here a lot of data everywhere. The data, it is just an awakening movement that all the physicians needs to think that are we going to treat these patients like this, left, right, with a number of symptoms. Why did we have Bell's palsy? I had 4 Bell's palsy cases on one single day. One single day and 4 Bell's palsy cases. One single day of multiple lymphadenopathy. One single day of hemangiomas everywhere. This is not normal. This was not there. Why? The question is my agony from inside. I'm just expressing whatever is coming to onto my daily day-to-day practice. And this is the time we keep a track that we are seeing lymphadenopathies, we are seeing autoimmune crisis, we are seeing. We can keep on talking like this, but this is, I just want to come across and put across my agony is like that we are seeing different kinds of vague symptoms, high hypothyroid, high autoimmune, young 20s who are all teenagers who got vaccinations. They are coming with rheumatoid arthritis, joint swellings, fatigueness, and now we are giving a big diagnosis called long COVID. If it's long COVID because of the infection, then it could be long COVID because of the vaccination also. So I have a lot of data that I can present, but in such a short period of time, this is the time I took time to wake us up, keep thinking. It is a thought process. I wanted to put this thing. It is a way to thought process. That's all it is. Okay, so I'm so this is what I would like to end my talk here, saying that this is what we want to do. Okay. I want to end my talk here saying that this is awakening movement. This is awakening movement. This is awakening thing. This is exactly what we need to do. This is awakening thing that we all have to come together. The scientific data people, everybody has to come together, and everybody has to come together, and we all need to speak out. Thank you so much for the extraordinary panel that that giving me this chance. And yes, we can do more talks of presentations of healthy, kind of lengthy discussions about how to each and every disease. Thank you so much.
Thank you, Dr. Sudha, and sorry everyone for all the nuisance, if at all it's happening. We move on to Dr. Gautam Das. He is the general physician. He has done his MBBS. He is a member of GRAP, that is Global Rational Alliance for Public Health. He is from Calcutta. So let's hear what Gautam Das doctor has to say. Yes, Dr. Gautam Das, please. Dr. Gautam Das, unmute yourself.
Let me share some of my experiences in our day-to-day practice. Over the last 1.5 years, we have seen many of our patients are suffering unused for prolonged periods of time, even after a small flu-like thing. We are having increased rate of allergic rhinitis, urticaria, skin rashes, oral ulcers, unexplained fatigue, chest pain, and to prevent functional disability of various forms, including sharp diminution of heart functions. Dr. Sudha has nicely said that I have seen in many some cases, even after simple viral flus or like that, CRP remains to be high for a prolonged period of time. Remain higher for 2 to 3 weeks after the fever is subsided. Interesting, most of them are vaccinated against COVID-19. And a good number of them are actually immune to the national infection, despite of the fact they were vaccinated. And there is no systematic study to know whether this mass vaccination has any relation with these newfound clinical problems. And it is a trend to attribute all the bad clinical outcomes to a newly coined term called long COVID. Things cannot be spent under the carpet like that, because we must know this COVID vaccination is the single largest invasive medical intervention in the public health field in our living day. It is extremely important to know the truth. Without a credible case control study, if we keep on attributing all these bad outcomes to a term called long COVID, it is not only irrational, it shows a dangerous trend too. Now the question is, what will be the biggest obstacle in conducting such a credible study in a convincing way? It is because this COVID vaccination was done without a control group. It means there is no defined population which were not vaccinated without a control group. And with this ongoing mass vaccination program, the situation is in a mess. It is highly likely that we may not know what is the truth. So, really, it is a fiasco. Now the question is, who is there on the part of the government or our public health agencies to come up and own this responsibility? We the practitioners, non-practitioners, and practitioners in all the fields, they need a clear-cut scientific guideline on how to deal with this situation. Not just a ready-made protocol. We do not say that. We need a scientific guideline. Why am I telling this? Because some of our patients informed us that some close relatives of them or their friends, they collapsed or had to be hospitalized within a week or days of vaccination. But they didn't report it. Why? It's because due to the absence of wide publicity on the part of the government on how to register side effects or death, most of the people are the victims. They didn't record it either out of fear or out of ignorance. And this goes another problem to this dimension to the problem. So, and one more thing I must say that many of our patients report that when they show their prescriptions in the vaccination center that they are taking some heart medicines or they are having some heart ailments, there was none to hear them and they were vaccinated. In fact, in many of the centers, we know that the minimum setup, emergency medicine to handle mandatory observations was not there. So our demand is that these newly found clinical problems that we are facing every day must be declared a genuine medical crisis and the public health agencies, including the top bosses, should get emphatically about the safety of the vaccines. Even we can remember that our DCGI, our own DCGI, while approving this vaccine, it said publicly to the press that this vaccine is 110% safe. Now the truth is that Around 1,000 people lost their lives post-vaccination. And around 29,000 side effects took place. So that assurance was supposed to response one. So it is a call to a government and public health agencies and give us a scientific line of action and look into the matter scientifically and convincingly. Thank you.
Thank you, Dr. Gautam Das. We move on to Dr. Megha Kansul. She is from Gurgaon. She is MD and pediatrician. Please, yes, Dr. Megha. Dr. Megha, unmute yourself. Rushil?
Yeah, I can now. Hi. Thank you so much, Dr. Gayatri, and thank you so much to my esteemed panelists and for giving me this opportunity. I am a pediatrician. I have done my MD and MBBS from Gandhi Medical College in Bhopal. And more importantly, I have done my neonatology. So I am now a neonatologist in a corporate hospital in Gurgaon. I have been seeing an increase in the number of neonates that come with unexplained causes of infection. So unexplained for some reason, children that are full term, that are having good, that should have absolutely no sepsis settings, suddenly have started having early onset sepsis in a degree far more than you would expect, even in a small hospital like mine. We are also seeing a very alarming trend towards having brain clots. We don't expect brain clots at all in babies as small as I see. And giving me a chickenpox vaccine is, and I'm not going to put a too fine a point on it, it is only making the manufacturers money. It is doing nothing else for me as far as my immunity is concerned. That is the last few waves that we have seen. That means if we are administering this, or if we are arm twisting parents or scaring them into saying that your child will be saved from something by doing this, we are actually giving scientifically completely wrong information. I will go as far as to say this is actually completely unseen till today. Has always been given last to pregnant women. The womb is considered sanctum sanctorum, conscionable. We should not have ever done this, but now that it has been done, at least let us stop now. Children and pregnant women, the most sensitive, the most vulnerable people on the planet should actually be kept as far from these untested materials. I'm not even going to call them vaccines. I vaccinate for a living. You do not inject a genetically potent substance into a human being and call it vaccine. They have changed the data, they have changed the definitions. When I was doing my pathology, this was called genetic engineering. You do not genetically engineer an entire subset of humanity by just telling them that it's vaccination. It is not fair and it is not done. And finally, and more importantly, the pediatric age group is going to start to see, we've already started to see unexplained hepatitis, unexplained neurological illnesses in adolescents, and heartbreakingly, the pun is intended, myocarditis. This is, again, I mean, we have children dropping dead of strokes and dropping dead of heart disease. As a species, we have failed our young ones. As a species, we have failed our young ones. At least the few professionals that I hear, out of the thousands that exist, at least they have some conscience left. I hope that we are able to carry this movement forward, because this is completely against any form of humanity that I know. And that's all I would like to say. Thank you so much.
Yes, thank you, Dr. Megha. We move on to Dr. Arvind Kushwaha. I hope he's here. He is MD Epidemiology from Department of Community Medicine, All India Institute of Medical Sciences from Nagpur. Can we have Dr. Arvind? Sir, unmute yourself.
Unmuted.
There's some issue with your audio.
Yeah, I'm unmuted myself, but am I audible? That's it.
We are yet not able to hear you properly.
Can you hear me now?
No, not properly. Unmute yourself, sir.
Yeah, am I audible?
You are audible, but that's quite a break in.
Okay, is it okay now?
Okay. Go ahead.
Yeah. So let me start with first thing that vaccines have proved to be the most cost-effective public health interventions in the past. And this is a truth which existed before the COVID vaccines were introduced. Now, since the COVID vaccines have
Sir, you're not audible now.
Maybe Dr. Gayatri, we move to the next panelist and then come back to Dr.
Yeah, okay. So just mute him for now. We can accommodate him next. Okay, then we move on to Dr. Lalit Anande. He has done his MBBS and postgraduate diploma in clinical research. He is from Mumbai. Yes, Dr. Lalit Anande, please. Unmute yourself. Rushil, I think you have to unmute him. He's not able to do it by himself, I guess. Yes, sir, you can say.
Okay, I hope you can hear me.
Yes, yes.
With so many learned doctors out here saying so many things. I'm thankful to Dr. Veena Raghavan pointing out to so many things, as well as Meghna, and Dr. Sudha also. When Meghna said, we failed. I mean, we really failed as a generation to give something to our generation next. My neck goes down in shame for what we have done to them. And when Dr. Sudha said, why not track the kind of adverse events which are happening post-COVID vaccination, what we are finding in so many people, in so many ways, why not track? I want to point out something. Why not track means, was this not a trial vaccine? Or it was a proven vaccine which had come in market and given to all the public? It is definitely a trial undergoing clinical trials of vaccine. And when something is undergoing clinical trials, the rule number one of this is to undergo training of good documentation practices. Where are we? What are we doing? Any documentations? It is a rule of any clinical trial. GCP, good clinical practices. GDP, good documentation practices. What are we doing? Absolutely zero. I mean, people who took the
vaccination. It was the duty of the medical officer over there to document all these things, whatever are happening post-vaccination. I am not saying immediately one day after the vaccination was done. It may be a week, it may be a month, it may be a few years also, maybe 5 years also down the line. It is very much necessity that you go on tracking all the thing and documenting all the thing. The digital documentation is there, but nobody does it. All the people who are getting vaccinated and getting all these smaller kind of things from fever, maybe lymphadenopathy, the lymph nodes increasing, to some liver problems, gallbladder problems, cancers and all those things. The site where they were vaccinating do not know any damn thing about it because the people don't go there and tell them. And more and above, it was a duty of the site which had vaccinated to go on asking, is there any problem? Nothing of that sort is also done. So, if you don't track anything, how do you come to know? In past, with all the drugs, they were tracking everything. In fact, there were so many drugs which came in market, and later on, they found there were some, after being used on larger scale of people across the world, they found some unique adverse reaction and they had to withdraw also. For example, I'm saying quoting an example of Viagra, which had become so famous, so popular. They did come out with, after a large scale use, that it has some cardiac problems. The anti-diabetic called pioglitazone. There are some others also, which they came to know had some adverse reactions. A very famously used, for acidity, something called Zintac was withdrawn from India. There are so many like them, which were withdrawn later on. Because of the adverse events were there, the adverse reactions, long-term things which were there. What is vaccine? What? Zero. It was forced upon by doctors to them that this was being caused, this myocarditis, this hepatitis, this gallbladder problem, this so many things which were documented because of the pressure from doctors. But what are the company doing? What is the regulatory authority doing? My biggest question to them. Zero. It is just because people are shouting, they are trying to do. Then why are they not doing it? Under whose influence are they? Why are they not doing it? Why are they making people suffer? It's a shameless thing, I must say. Beyond my, why are we not tracking? And we are facing with so many kind of things. The explosion of cancer, explosion of tuberculosis, explosion of so many things people are presenting with. And these are close people. A few of my relatives did die. A few of my friends did die of the cardiac problems and all the clots and all whatever they are saying. Nothing documented. Where are we going? I leave it upon the learned people of this group because I have my serious complaint against all the regulatory authority bodies all across the world who audit the clinical trials are doing nothing and sitting quiet because of some higher up pressures to them in a shameless way. Nothing else I would like to say. Thank you.
Yes, thank you, Dr. Lalitanande. Next, we move on to Advocate Nilesh Oja, sir, since he has some work ahead. He is a president of Indian Bar Association. So let us hear some legal aspects and help from sir. Sir, please.
Hello, everyone. आवाज आ रही है सबको?
Yes, you are audible.
ठीक है. So, first of all, I will congratulate and appreciate all the doctors for their honest and bold work.
the representation prepared by doctors is short but substantive, and I think it will solve all the purpose. Though it is softly worded, as per law, all these vaccine companies and the bureaucrats are doing, it is nothing but an offense in a criminal nature. First thing, some of the prayers are already at the verge of being granted by the government of India, because on 2nd September, Kerala High Court gave direction to the Union of India to formulate the guidelines regarding granting compensation to the person who are died due to side effects of vaccines. So far as other things are concerned, there will not also Bombay High Court issued notice for granting compensation to the family members of the Dr. Snehal Lunawat. Then there is one more development in Supreme Court in Rashna Gangu's case. The Supreme Court also issued notice to the Union of India. So the sum and substance of everything is that when these pharma companies and their I say co-conspirators are taking credits of lowering death due to vaccination, they only because the people who are vaccinated are dying in this percent and that percent. The same analogy is applicable to the deaths and the side effects in the person who took the vaccines. So in this case, they are running false narratives and conspiracy theories, and the articles published regarding long COVID and others are in fact the part of their conspiracy, because in that article it is nowhere stated what is the status of the person, whether he is vaccinated or not. So I hope that initiative by all the doctors, more particularly all the honest and brilliant doctors, will cause a deterrence, and it will open the eyes, and it will be an eye-opener not only for the bureaucrats but also to the common man. My all best wishes, and I hope that very soon this cause the mission of transparency and the mission of sending these mafias who are playing with the lives of the humanity to jail will very soon be completed. Thanks, everyone.
Yes, thank you, sir. I think we can now take Dr. Arvind Kushwaha. Arvind Kushwaha, you can now talk.
Okay, can you hear me now?
Yes, we can.
Okay, so the point is when the vaccines were introduced in COVID pandemic, it was seen as a huge promise, and probably we were told that this will end the pandemic. But unfortunately, we are in a situation today where probably now we are dealing with the pandemic of the vaccinated. We are facing a lot of problems because of the diseases and the disabilities and the deaths that are occurring among the vaccinated, and probably because of the vaccine, so it needs to be investigated properly. So to undertake as to what is the volume of this adverse events following immunization in India, I undertook a study, because on searching the literature, there were no studies which were targeting the serious adverse events. Most of them initially came with things like very minor kind of adverse events which are common to every vaccine. So obviously COVID vaccine would also show that. So here I undertook a study on the serious adverse events following immunization from the data that was available from the Ministry of Health and Family Welfare. And to my surprise, it was not easy to find that data. However, once once I got hold of the data, there were 13 such documents which were there on the Ministry of Health and Family Affairs site, and from that I conducted my study. So basically, before I move on to the results, I just want to say a few things about this, like unprecedented rapid development of vaccines in COVID pandemic and the rapid deployment over such a large scale was something that we have never seen before. And probably it was shown to us or told to us that this is going to solve the so-called biggest, kind of pandemic of the century. But somehow we are at a state where we are now recording AFI or adverse events across the world, and they are leading to a lot of new issues like increased deaths, increased cardiac issues, increased cancers, and all those. So we have seen in the past that certain vaccines which did not do well, they were halted or they were stopped. I mean, their use was halted, their use was stopped. Like, for example, there was a rotavirus vaccine incident. There was an incident of death following flu vaccination. Both the vaccine trials or the implementation were halted in the past. So if we have done it in the past, it is amazing that why we are not able to do it now. This vaccine, COVID vaccine, hasn't really served the purpose of meeting two criteria, that is being safe and being effective. It is proving to be neither safe and nor effective. In both the senses, it is failing the definition of a vaccine. So we did this study in India, and as I said, 1087 such incidents were recorded, which were from March 2021 to March 2022, and this included the serious adverse events, out of which 387 deaths and 700 hospitalizations were recorded. Unfortunately, out of this 1087 incidents which were there, 90% of them were labeled as coincidental, and probably most of them were labeled as coincidental, not due to the vaccine. Now, based on these, we did an estimation as to how many such incidents could be there in India as such. So, based on two assumptions, that is, one is the underreporting factor. So, if we see the VARS, there also the underreporting is there from 1 to 5%. Antibody dependent announcement of infection, other things have already been talked about. I don't want to talk about that. But what we need to do is stop this vaccination forthwith. No further vaccination of any children should be done. A very good vaccine adverse event reporting system should be put in place, and most importantly, investigate all deaths occurring henceforth in detail to rule out the role of vaccine. That's all I have to say. Thank you.
Thank you, Dr. Arvind Kushwaha. Move on next to Dr. Ajay Gupta. He has MBS and he has done his masters in ortho. He is from All India Institute Medical Sciences, Delhi. He was pioneer in establishing correlation between ECG-induced immunity and COVID-19. Many publications in peer-reviewed journals on COVID, while serving COVID patients in NCR, the largest COVID hospital. And currently, he is director, professor, head of the department, Azad Medical College. So yes, Dr. Ajay Gupta, please, can we have you?
Actually, he's dropped from the call. Let's take the next panelist and then come back.
Okay. Then we move on to Dr. Banu Prakash. He is a neurosurgeon. He has done his MS in neurosurgery. He has published nuances of surgical skills, developed patient care module. Modules to guide doctors holistically through karma therapy in auditions. He is from Bangalore. Yes, Dr. Banu Prakash. Please unmute yourself. much. Can you hear me?
Okay, now, hello friends, everybody. I would like to share some of the pictures here because the list of starting with first thing, we Dr. Nilesh Oja sir created one template of what we call the COVID exemption certificate, and I improvised on this, and we started distributing the certificate so that those who are not interested or those who are not believing in the what do we call the COVID vaccines benefits would exempt themselves from the certificate from the injections. So with these with this format of COVID exemption certificate, which ran into 8 pages, we could give information, complete information to many of the people who wanted to know what exactly it is. And then many started not taking the injections, and definitely we prevented lot many complications with that. And coming next, I started circulating what is this is a AEFI form. I think this is the AEFI form which we need to circulate to everybody so that everybody knows what is how to report an adverse event and how to create awareness among the patients, among the doctors, because this is not given at all even to the vaccination centers. Am I being audible? Hello? My video is not seen because I'm sharing.
This meeting is being recorded.
You're audible, sir.
Thank you. So this is the AFI form which I particularly insisted to be kept on every doctor's desk in all the hospitals I visit, and I usually copy around 10 to 20 forms of this, and I started reporting most of the cases. And many say that this is difficult to fill, they give lame reasons, our OPD is busy, we can't fill it up. Until unless we are communicating, we are giving feedback to the people in the authority and also the health authorities, we will never ensure an awareness, because many of these people are not even aware. They have been misled by propaganda that everything is okay, nothing is going to have, no problem is going to happen. And even the patients, even the people, general public, even the authorities and the politicians, they are all in this propaganda. So we need to fill out forms as doctors. And I have filled up form for people who have been treated by others, but just come that saying that okay, these things happened after the vaccination. So and okay. One second. Sorry, my PowerPoint, my laptop is not connecting. And this is the instructions to fill up the form. So these instructions are very simple, and it can be easily done. So that they have to, everybody has to voluntarily, and we as doctors, we should take the initiative. Till now, I have filled up nearly 150 forms, and so definitely that created a great impetus. See, this is one important patient who developed something like meningoencephalitis and hydrocephalus with sinus thrombosis. So this is what I got, and he had a brain abscess also. So these are the cases we need to report, and when we report such cases, then only they will realize that there is something which is going wrong. A 15-year-old school girl who received a vaccine and then she had seizures. So we need to report it so emphatically. Then only they awaken. Then this is another patient who developed multiple brain abscesses, which recurred even after multiple surgeries. So then again, coming to this patient, here an important thing: the husband took the infection, the husband took the injection, wife had mild COVID sort of a fever, and then she had an abortion. Why? Because the gynecologist on anomaly scan identified that the child did not have a heart development. So the vaccines are not just affecting the same person, they're affecting the family members also. So that is what is the observation. And so one patient had very similar symptoms like nanofilaments going in his veins. So he could feel the filament like irritating worm-like feelings in the veins. And these are some specific unique AFI forms which have built up. And this is another person, 36-year-old, who was well and healthy, a mechanical engineer working in ISRO on contract basis. He developed hypertension of BP 250 by 150 just 3 months after taking the injection, and then afterwards he had an aneurysm which bled, and he didn't have money. We had to be sent to a government hospital for surgery, and that's how we had to manage. And next is this one was a post-COVID injection encephalopathy with toxic effects and causing Parkinsonism disease, and the lady was in very difficulty. Then next would be, so this was a young lady with spastic quadriparesis, and what I have observed is there is a different racial what do you say, specificity, because those papers have also come out saying that there is a racial specificity for the COVID disease also, and also the injections also. So this patient, he had stroke during the COVID wave, and then after taking the injection he started having seizures. So this is what is all the the specific targeting of the races. So this is a patient who developed stroke after the booster dose, and I want to say at this point that one of my close friend, a neurosurgeon, was also my age. He took the third booster dose voluntarily, the first person to take the dose in his hospital, and 3 days later he suffered a massive heart attack. Even in Karnataka, there is a famous actor, Puneet Rajkumar, who took the second dose. He was a mascot for the vaccination drive, and he suffered a massive heart attack after 5 days, and he died. But the news is covered up. So, and coming to the other, like after this booster dose, okay, this is another patient. She died. I have given recently AFI reports for many patients who have died. I couldn't retrieve many of them. Many elderly people who had come with strokes, and this is a young lady who just had delivered, who had massive cerebral venous thrombosis, and this lady died after, even despite the surgeries. So and okay, so after all, nearly some 150 AFI reports, now doing public awareness campaigns, giving exemption certificates digitally signed across all the public social media, and calling up and meeting many of the authorities, the public health authorities, the politicians, and even the bureaucrats. Then it went to such an extent that even the municipal commissioner of Bangalore, he complained to Karnataka Medical Council saying that because at one point it was a crux wherein the poor people who are working in the garments and other factories were forced to take the injections for their survival and to be working in the jobs. So I just used some harsh words, and they made a big issue out of it, to the extent that they were trying to remove me from the roles. And thanks to all the members of the Awaken India movement, they bombarded them with the mails, they bombarded them with the evidences. So definitely they are saying that we'll take the decision. I had to go nearly 6 months every month to the council, and then give them evidences one after the other. And ultimately they have said that we'll just discuss and decide. Now the BBMP, that commissioner who had complained, himself is removed. So this is how we need to be persistent, we need to be deterrent, and we need to be very much with conviction to fight against this. Otherwise, definitely, even in our Neuro Club, it was a great fight for me to ensure that every case presentation they did, they should tell that whether the patient had suffered COVID, whether the patient had taken COVID injection, and could this be a complication of the COVID injection. So this is what we need to ensure. So unless we do, like we insist and persist, we'll never ensure truth for everybody. So this is how gradually now after the AAFI forms, we need to insist that we need to ensure that the patient and their relatives go to the authorities, file for compensation, ensure that they get compensation, and also get treatment for their problems in the hospital of their choice at the cost of the government. This is, I request Nilesh Oja sir to do this because he has been fighting for the cause. Even the case which he has filed for 1,000 crores, that the public prosecutor says that the government is not responsible, the vaccine company is responsible. That is the hilarious thing. When the government propagates it, let the company propagate it then. Why did the government propagate it? They have to be equally responsible. We need to make them, hold them accountable, and we need to ensure that everybody who will suffer the complication or a death in his family gets a compensation through a legal fight. So we have identified few advocates in Bangalore who are fighting for the cause, and definitely in future any policy making, be it related to health or any other thing, there should be public participation, including the citizen, including all level of government and private people in the system, be the healthcare workers, before the policy is made and before it is implemented. So such sort of a decentralized governance should become the norm. And therefore, and we need to be thinking about the biological battle, the depopulation agenda, the supremacy psychosis, wherein these things are implemented, and also the ongoing third world war of weather warfare, the floods, the famine, and the food fights which are being planned, the day of slavery by the elite few to own the world through their mechanization, and they are planning a great reset and a new slave world order. And we need to fight against this. Let us ensure we fight with the great. And I just finished with the survival movement and a great resurrection of the truthful world with equality, justice, opportunity for all the aborigines to live. So definitely, this is what is my perspective and my this thing, and I have gone through this because I'm a MBBS, MS, and MCH neurosurgeon from PGH Chandigarh, and this is as a clinician what my observation is. And if I have started this so-called the truthful movement to ensure that we all need to be truthful to the core, and we need to ensure that we follow the dharma of filing the AFI reports. Otherwise, any doctor who doesn't file a AFI report, who gives lame reasons that he doesn't have time and he doesn't have the energy or the forms, is actually will suffer the karma of it. So let us ensure that we all fight against it together in a big way for to ensure that there is a truthful word, the truthful health policies, and the healthy living of everybody. Thank you. Let us create the heaven and earth, and let us be Vishwamanava and create a truthful world. Thank you.
Yes, thank you, Dr. Banu Prakash. We move on to Dr. Amar Singh Azad. He has done his MBBS and MD in pediatrics. He is also having MD in community medicine. He is a retired senior medical officer from Patiala. Yes, so Dr. Amar Singh Azad, please, can you unmute yourself? Yes, sir.
बहुत ही बड़ा जो एनालिस्ट ने जो डिस्कशन की, बाय एंड लार्ज मेरा फुल एग्रीमेंट है। और मैंने डे टू डे प्रैक्टिस में काफ़ी पेशेंट्स ऐसे आ रहे हैं जो जिनमें क्लियरली डाउट क्रिएट होता है कि ये कोविड कैसे जुड़े हुए हैं, तो वो काफ़ी अच्छे तरह से एलेबोरेट हो गया। मैं थोड़ी सी बातें MBBS का मैं MD पीडियाट्रिक्स किया और MD पीडियाट्रिक्स का करके मैंने कम्युनिटी मेडिसिन ऑप्ट किया, क्योंकि मुझे वो जो क्रेज थी कि डिजीज के कोर पे जाना है, उसका रूट कॉज क्या है, तो पूरी क्रेज को बाद में 50 साल में मैंने जो प्रैक्टिस में किया, और बाद में एक एक्टिविस्ट के तौर पे भी मैंने काफ़ी कुछ किया कि जो कुछ समझ आता है तो लोगों का शेयर करना है। तो ये पूरे जो मेरा एक्सपीरियंस रहा, और आज अभी करंटली आई एम बेसिकली होलिस्टिक हेल्थ केयर प्रैक्टिशनर, और उस हिसाब से काफ़ी कुछ जो मैंने सीखा पिछले सालों में, तो उसका थोड़ा सा जो बुलेट पॉइंट से मैं आपके साथ शेयर करूँगा। एक एपिडेमियोलॉजिस्ट व्यू पॉइंट क्या होना चाहिए, और क्या बेसिकली वैक्सीन के बारे में 4 सवाल पूछने चाहिए कि क्या इसकी ज़रूरत है, पहले तो क्या इस बीमारी के लिए वैक्सीन की ज़रूरत है। नंबर 2 कि क्या वैक्सीन बनना पॉसिबल है। नंबर 3 कि वैक्सीन क्या इफेक्टिव हो सकता है, और चौथा कि वैक्सीन सेफ हो सकता है। पहली फर्स्ट थिंग इज कि देयर इज नो नीड ऑफ any vaccine against flu viruses. क्यों कहता हूँ? क्योंकि फ्लू वायरसेस की जो अपनी इम्यूनिटी क्रिएट करने की जो परसेंटेज है, दैट्स वेरी वेरी हाई.